Hi everybody, welcome back. Once again, we're here with Dr. Swan. Dr. Swan, I mean, every time I talk to you, I feel like I get a college lesson, so thank you so much. Just to kind of recap, we've talked about the problem, right, where we have seen declining sperm counts, testosterone, all kinds of health effects, children being affected in the womb, so far so on. Now, what we wanted to do is transition for you into the causes and kind of specifically identify what are the causes and call them by name, because if, as a consumer, that's one of the big things. I talk to people on the phone all the time. I'm like, you have to read labels, and they're like, well, what should I look for? What's really affecting me? So we'll talk about that a little bit, and I'll let you lead that.
Definitely. So again, your book was the big why for us. We're treating the patients. We're seeing the consequences of those EDCs. Now we're going to talk about what is causing this decrease in sperm count and in testosterone. The first thing I'd like you to go around is lifestyle factors.
Sure. So let me just start even further back.
Okay.
Okay, and say, if we look at causes of any biological phenomenon, we can say it could be genetic or it could be environment, right? This cannot be genetic because it's too fast. It's 2 generations. You don't get evolutionary change in 2 generations. Okay, so let's...
So I'm sorry, I so agree. So our gene pool didn't change that much to account for that much disease.
Right.
That's what you agree.
Yeah.
And also important from a layman's perspective, there's a lot of people that say, oh, it's just my genes.
Right.
And we now know that it's not true.
Right.
Right.
So if you put that aside, then you're left with environment, which is a very big basket, okay? And in that basket, there's a lot of things, including chemicals, but certainly not only chemicals. But I work in how chemicals of various kinds affect our reproductive system and our health in general. That's what I do. But just let me say this is not talking about heat. It's not talking about noise. It's not talking about lots of other things that are not chemical, okay? So environment is much bigger than chemicals.
Yes.
Okay, then when you now we're shrinking the pool of possible causes, right? So then you go to the chemicals and you say, well, which chemicals? Well, there's one special class of chemicals which we've already talked about, and that's the endocrine disrupting chemicals. And the reason that we're going to focus on that now, and why I focused all of my work on that, is because I'm talking about the reproductive system. And the reproductive system is intimately connected with hormones, as we've discussed. So now we're kind of closing in on the bad actors, if you will. And these are going to be endocrine disrupting chemicals. That means chemicals that can affect the body's hormones, right? Which ones? Okay, now we can narrow it further because we know that here, and my work is about reproduction. And reproduction is involved with specific hormones, which are the sex steroid hormones. So from this huge pool of environment, we've come now down to sex steroid hormones. But it's not the hormones ourselves. It's not that we're exposed to hormones. We're exposed to things that affect our body's own production and distribution and control and so on of these hormones. So it's something out there that's coming into our body unknown to us, without our permission. It's not like taking a drug or smoking. It just comes in and then makes changes in our body's hormones, which, as you've heard, is absolutely essential for the functioning of the reproductive system.
Because for me, what I understood when I started learning about EDCs, I'm like, oh, okay, if I don't drink out of plastic bottles, I can protect myself. Then I didn't realize, and I'm quoting your book again, the ubiquitous nature and presence of those chemicals. They're everywhere. It's everywhere. We put it on our skin, we eat them, we breathe them, they are
Eating them,
house,
drinking them.
everywhere. So it's almost impossible to stay away from them. So what I would like to do is go almost organ by organ, like breathing, smelling, eating, and we identify some chemicals for our patients. So the first one, and I think that's a really big one, is cosmeceuticals, what we put on our skin.
Makeup,
Right.
shampoo.
So personal care products, I like that word, cosmeceuticals. They are full of these chemicals. And again, he keep referring to the study we conducted because by conducting those studies, that's how I learned
And that's
best.
how we learn.
And that's how you learn. So we asked these women who gave us their urine samples what they put on their skin and on their body and what kind of laundry detergent they used and on and on and on. And what we found was that several of these products were related to higher levels of particularly phthalates in the woman's urine when we tested it. It's very simple, it's not rocket science. So it turns out that everything with fragrance is going to have phthalates and also some phenols. But I'm most concerned about the phthalates because they lower testosterone. And so that means, so think about it, if you have a hand cream, you put it on your hand, just put it on the surface, and then you go about your business. If you came back and looked at it again 15 minutes, it'd be gone, right?
Absorbed.
Because it's absorbed. And phthalates do that. Phthalates increase the absorption of chemicals.
Oh my
It's
goodness.
not just your skin. They put it in pesticides because it increases the absorption of the pesticide into the plant.
Wow.
So anytime you want to increase the absorption of a product into
Add phthalates.
Keep with phthalates.
add phthalates.
Wow.
Sounds easy, bad for us. Okay, so it also increases the retention of color. So it's in lipstick and it's in nail polish. Definitely retention of color and also retention of smell, scent. So it's one of the reasons it's put into things that
Fragrances,
smell.
yeah.
So, so everyone says, well, how can I avoid it? And I have huge question, but I have one suggestion, which is that you can go to your browser and put in Environmental Working Group, which is a nonprofit. They're not getting anything out of this plug. And just put in the name of your product. So there's consumer guides, guides for sunscreen and guides for laundry detergent and guides for cleaning products and so on and so forth. And they test these things in their laboratories and they give them a rating. So I do that. I go and I say, here's a new product. Is that okay? And I look it up and, oh, not so good. It's a 7, or it's great. It's a 1, or, you know. So you can do that.
Definitely.
But and aside from that, general things are smell it. If it smells, it's going to have phthalates. If it's something you plug into the wall or you hang in your car or you put in your bathroom, there's these things, and I see them now in the restaurants a lot, you know, keep the smell nice. And so, no, it's not a good idea. It's better to get the other not
Candles
so pleasant
as well,
smell.
is it?
Yes, candles, absolutely, absolutely.
So again, in your book, you talked about this, that after the end of World War II, and this is when really they invented plastics and they really pushed the production.
Right.
And the motto was better living through plastic.
Through chemistry.
Through chemistry.
Right,
Through chemistry.
right.
But plastics does make our life better. Let's be honest.
Right, absolutely.
When you put a nice cream that gets absorbed and smells good, you love it.
Right.
And then I tried the one that doesn't have the phthalates. I'm like, it's not being absorbed. Although I have to say, because there's been such a pressure,
They're getting better.
There's getting better and better products. And the impetus for all this is that we can eventually demand by voting with our wallet that we want better products. And then if there's a mass of people who say, I will not be using those products with parabens, phthalates, for example,
Phenols,
phenols. The big one for me was, we live in Florida, so it's sunscreen.
Sunscreen, of course.
Sunscreen,
Oh, tell the story
oxybenzone.
about-
Yeah, that little episode of mine, I say it all the times. There's more now, but we traveled to Hawaii, and there's about 7 beaches in the world where you cannot use regular sunscreen. When you go, they stop you, they look at your sunscreen, they get rid of it, and they give you a mineral sunscreen. I was like, oh, okay, let me follow the rules. And then they told me you can't use it because it bleaches corals. And that's true. I'm like, okay, no problem. I care for the corals. I put this, it sucked, it stayed on my skin all white, but we did it. Then when I did my research, that chemical oxybenzone does cause infertility in zebrafish. And zebrafish population will go down when oxybenzone goes up. So they're like, oh, so you're protecting the fish, but you don't care that I lather myself with sunscreen every day, and then what's going to happen to me? So again, very important. I'm not saying don't put sunscreen. Watch what's in your sunscreen.
Well, not even you, just also the mothers putting their sunscreen
That's
on their
I was about to say
Consistent.
that. I was about to say
Right?
that.
Or-
Or
every single
they
day.
put the sunscreen while they are pregnant in the first trimester. What did we learn?
Right.
First
Yeah,
trimester
yeah,
is
yeah.
the most
Most
important.
important.
So if you're trying to get pregnant, you really should be looking at everything that's in It is overwhelming, but we have to do this.
Yeah, but it's such a common thing, right? Like we live in Florida. We have a 2-year-old. I have a 2-year-old nephew, right?
Yeah.
And before knowing this, it was like, I mean, lather him up in this much thickness of sunscreen,
Yeah.
and now you know that he's being affected with all these.
But
tablets that
again, there are now better products that mostly mineral sunscreen.
Yeah.
There's
Yeah.
a lot
Zinc.
of personal care products that don't have those. So, environmental working group,
Yes, EWG.
EWG.
We'll put that
really
website
important
for you guys.
For you to follow this. So I wanted to start with the skin because this is the largest organ that we have. So
Right.
if we think about the amount of stuff that we put on us, that's a big place where we get phthalates. And I can't stop thinking about the commercial for Axe, the young man that
Yeah,
just
yeah.
keeps,
Yeah, I used to
and
put it
all
all
the
the
girls
time.
come to him. No. When you do this, your testosterone goes down.
Yeah.
You won't be able to perform.
I didn't
You
suffer
will-
that though.
So very good. So we got the skin.
Yeah,
Now
okay.
let's talk about our food. How do we eat?
Optimizing your health is only a scan away. Select the QR code that fits your profile best, and we look forward to hearing from you at the Medical Health Institute.